What happens next? Who explains the diagnosis of dementia to the person themselves and possibly to the relatives? And what other decisions, what other choices have to be made at that stage? So perhaps you could help us with that.
Yeah. When the diagnosis is made, obviously it's a huge diagnosis for the families and for the persons who are caring for people with dementia. The community mental health teams will take a background history, the information, they gather the past histories, do the mental state examinations, and the nurses and the psychologists will perform the neuropsychological testings and specific testings for the dementia patients. And then they're offered the CT scans or the MRI. And when the results are back, after ruling out all the blood investigations as well, then when they've come to a conclusion of a diagnosis of dementia, the CMHTs will offer an outpatient appointment for the person, or a home visit is organized.
So the first thing that a person might hear about this at the end of the process is that they would receive a letter from their GP or from the CMHT, either inviting them to an appointment or asking to make a visit?
Yes, the CMHTs will offer an appointment letter to them for them to come to the outpatient clinic, and they will be having the discussion about the diagnosis because it will have an impact on the families. That's why they're discussed in a very sort of confidential environment as well.
What sorts of things will they want to discuss with that person and with their relatives?
They'll discuss about the diagnosis, that is the main thing. They'll disclose the diagnosis in a sensitive manner. They will talk about the treatment options available if that dementia is a type where they can give the medications. They will also talk about the help and support that can be provided by the family members and the informal carers who will be helping in terms of family and friends who can support the person. They'll also talk about the advanced directives which a family can help in making a decision about if somebody doesn't want to undergo some sort of treatments or other options available for them. They will also discuss about the lasting power of attorney, which is one of the important decisions the person has to take to appoint somebody when they have got the capacity with reference to their finances and also for the health. We'll also discuss sometimes the cases about driving, when people are driving and they are having problems with memory. So to contact the DVLA, the families and the carers can help do that. These are some of the common things which were discussed in the first instance.
Thank you. So the general advice is that if you have a diagnosis of dementia, or if somebody close to you has a diagnosis of dementia, then involve the family as carers and as people who will have to take increasing responsibility for that person. Is that right?
Yes, absolutely. Research has also suggested that people who provide the help and support of the family, if they are family members, they do have a job satisfaction sense in them, and also the person whom they're caring for would like close relatives or family to provide that care and support. Though it is quite difficult at times because the families will be working to work around that, but families are the best people to care and look after the person with dementia.
Thank you. So if families are the best people, who else needs to be involved in caring for that person?
Obviously, in some circumstances, families are not able to provide that support, or they're not available to provide that support. In such instances, social services do a huge amount of work in terms of providing carers who can come in from one carer to as many as 4 times a day. And they will be doing mainly the personal care for the person, and also helping them get oriented to the surroundings, and also doing helping them doing the activities of daily living. Some of the other NGOs, organizations like Alzheimer's societies, will be able to provide a lot of help and support and guidance to the family and carers of people with dementia. There are other organizations like Age UK, Age Concerns, who will be working very closely with the people with dementia and their families to provide such support.